Hi, Dr. Rambob. I hope you have a good weekend and you also have a good spring break as well. So I have watched the session where everyone make a presentation on patient with special needs such as a patient with ADHD, with Alzheimer and Parkinson. And my key takeaway is that just like with most patients that have special needs, we always have to treat our patients with utmost patience and also with sympathy because these patients obviously need more time and care and attention than just like normal patients. We also need to pay attention to some modification in our treatment plans too. For example, patients with Parkinson usually are treated with levodopa, so we have to limit the amount of epinephrine injection just so it won't raise their blood pressure too high. And for patients with Alzheimer, sometimes treatment plans may not work out as we expect because these patients have some trouble in memories and in cognitive function. So for example, if we gave them just an overdenture and we expect them to wear it every day, they may forget to do so and the treatment plan may fail. So we should offer other options. For example, we could look for implants, or we can do just more simple denture that the patient hopefully can help the patient to put on every day. Or for patient with ADHD, there's a tendency according to some studies they have more prevalence in caries, and because they also eat and drink 5 times more than normal patients. So it's important to do the oral screening for them and help them to maintain the oral hygiene regime every day with some more either through simple explanation or modification. But I think overall with all these patients, it's also important that we pay attention to their consent, because sometimes it's easy to mistook that these patients, they are not capable of autonomy, but maybe actually they just have a bad days, or they feel anxious when they see a dentist, or for some other reason. But if it's possible, we should let the patient sign their own consent form whenever it's possible. And if they have their own guardians, that's also good too, but don't just rely on too much on the guardians, thinking that the patient is not capable of signing their own consent form. So these are my key takeaways.